For the oral care of patients who are unable to clean their own teeth, integration of medical resources and caregiver knowledge of the patient's condition is needed. Caregivers should perform dental hygiene routine for long-term care patients. It is best to clean the mouth after eating food, and once more before sleep. If the patient is weaker physically or experiences difficulties, oral hygiene should be performed at least once in the morning and once in the evening, and a fluoride mouth rinse should be used after meals. Oral hygiene routines should be carried out in well-lit conditions, preferably while standing behind the patient. Uncle, let's brush your teeth. While taking care of patients with dementia, he may be resistant to receiving oral care. The caregiver may need to use techniques such as desensitizing massages to help patients get used to the sensation of a foreign object in their mouth during oral care routines. First, the caregiver should follow the physician's assessment of the appropriate cleaning method. The paralytic's side usually accumulates plaque more easily, so caregivers need to make sure the paralytic side is cleaned. Because these patients may have stiffness, difficulty expressing themselves, and even difficulty swallowing, raise the backboard 30 to 45 degrees during oral care to prevent choking. Check for any food residues in the patient's mouth, and then follow the general cleaning procedure. Uncle, try it yourself. When symptoms occur, do not force him to undergo oral cleaning. Caregivers should explain thoroughly, making him feel at ease, and establish a good relationship before moving on to the next step of caregiving. To take care of these patients, caregivers need to have more patience and empathy to avoid discomfort, sensitivity, pain, and relative stress caused by oral hygiene activities, since some of these patients are unable to express their distress. That is why caregivers need to be more meticulous, as even leftover water in the oral cavity can be life-threatening. I hope that all caregivers will work together to protect the patient's oral health. Good oral care, good health, no worries.